Hi guys, welcome back to D Squared Classroom. Today we're going to talk about heart attack and what exactly a heart attack is. It's something that affects Americans literally every 5 seconds, which is a staggering statistic, but I think most of the population doesn't really have a good understanding of what happens internally when a heart attack does occur, and so we're going to try to explain that today. So here's the heart. Quick refresher, there's the right side of the heart, which is going to send blood to the lungs. It includes the right atrium and right ventricle. And the left side, left atrium and left ventricle, are going to send blood out to the rest of the body through the aorta. The muscle that encompasses the heart is called the myocardium, and that's filled with a network of coronary arteries, which are feeding oxygenated blood to the heart muscle itself. If we zoom in on one of those coronary arteries, it's a vessel, it's a tube, and blood platelets, which are carrying that oxygen, are flowing through that tube. But if you end up with a lot of fatty deposits inside those arteries, which can happen for a multitude of reasons, including poor diet, you can actually end up building up plaque so much so that it starts to preclude the flow of red blood cells through that artery. The term for this buildup of plaque is coronary artery disease, and for many, they're able to get by with that reduced blood flow to the heart muscle because your body compensates in other ways. But in the case of a heart attack, or what's otherwise known as an MI, a myocardial infarction, that plaque buildup becomes so severe that plaque actually starts breaking off, and the blood cells actually want to fill that space, and you end up with a full blockage. Now, that coronary artery was the pathway for oxygen to get to the heart muscle, and now because of this blockage, the rest of that coronary artery is non-functional. And because it's no longer getting oxygen to that section of the heart, there's a whole area of tissue that can actually die, and that means that that section of the heart muscle isn't able to pump. Now, if you look underneath at the area where that dead tissue is, it's right by the left ventricle in this case, which can be really problematic. Now let's take a step backwards for a moment and assume that we were able to catch that buildup of plaque from that coronary artery disease in that particular vessel before it got so bad that a clot was formed and ultimately a blockage caused that heart attack. You could go in with a little shovel and dig away at that plaque. That's a procedure called an angiogram, and the idea is to just break the plaque away so that the blood flow has a clear path. But that may be something that's only a temporary solution, so a lot of patients end up, during that same procedure, getting what's called a stent, which is sort of a very tiny piece of metal that will literally hold the coronary artery open so that you don't end up with the plaque buildup and ultimately the risk of that clot and heart attack. If a blockage isn't addressed immediately, it can lead to cardiogenic shock where you're not getting enough blood flow to the body and ultimately death. And so it's really important that you recognize the signs and symptoms of heart attack, which would include chest pain, pain in the shoulder, arm, or neck. It could even be extreme fatigue or nausea. There are patients that experience what's called a silent heart attack, where they don't really necessarily feel the symptoms at all. But if you do recognize any of these, it's important that you call 911 and make sure that you or the patient gets medical attention. So understanding what a heart attack really is should motivate you to live a heart-healthy lifestyle. Things like healthy diet can prevent that plaque buildup. Exercise is helpful, avoiding things that we know are bad for your heart like smoking. And in the end, that will help keep your coronary arteries happy.